Welcome, everybody. Many thanks for making time to be here today. This is our first Waves to Work, Connect to Work on the Coast workshop. We've got some really good presentations to come, but hopefully the majority of today is really discussing and sharing things with each other. There's too many people to do introductions, but if everyone could put your name and title into the chat box so everyone else can see who's here, that would be great. These sessions are really about coming together for the CNN aspect that is the community of practice. And I think sometimes we don't celebrate enough how much work's going on and how many good things people are doing. And the things in the CNN locations that they've prioritized locally, and with some key national colleagues here as well. And for some of those, it might be the first time they hear about some of this. So I hope, there's really useful cross learning from very local areas and to national important policy agendas like Connect to Work. It is about learning and really learning from each other. What can we transfer? We've always said about the CNN that it's really hard for one local coastal area to be prioritized, but when we look at it as a whole, and we've got over 18 locations in the network now going right around the coast, so it's thinking about the coast as a place and looking at this as scale that really matters, so we can get relevant transferable examples, and ultimately that helps us accelerate what people are doing and providing practical tools that can be used locally. So I hope a lot of that will come out today. Couple of ground rules. Please keep your cameras on when people are speaking. I think sometimes we forget in this digital age just how much it matters to be able to see people when you're talking, even if you're on screen. Share opinions, put questions into the chat, please. We'll use yellow hands during the group discussion, but we won't be responding in the midst of people speaking. The session is already being recorded, and we will be using that, as we have done with other workshops, to share that recording with everybody afterwards. I just want to give an introduction to the CNN really, and some of the key things behind the network. If you look here at the demographics, what we see over the last 100 years is a really significant shift in the makeup of the demographics on our coast. 100 years ago, the boom time of our coastal towns, really, of that classic V shape. And you see already by the 60s how much that started to change. And that's, nearly 15 years after the creation of the NHS, our health services, and a lot of our structure was built around that demographic profile. But as you can see, it's dramatically changing from where we began and even from the 60s. So that in the coast particularly, we have a burgeoning growth of older people, many of whom are now living up to 10 years longer in poor health or disability. And we have an out-migration of younger people from our coastal areas that we don't see replicated in the cities. The cities are still attracting young people in, but in the coast we have a reverse pattern. And as that trend continues, we'll end up with an inverted V in the opposite picture of where we started in the 20s. So it's really important, and the Chief Medical Officer focuses on this demographic shift a lot. It's a key aspect of what we're struggling with in the coast. But alongside that, so we know we've got, higher numbers of 65 plus people, but in terms of employment, we're seeing significant changes. These are national trends, but they're much more acutely felt in the coast, where we have younger age groups who are now economically inactive due to poor health or disability. And the fastest growing group in that category are our 16 to 24-year-olds. And that's very much marked by increasing mental health problems. So we have an intergenerational pattern behind that demographic shift that's really critical to thinking about employment, thinking about futures of young people, particularly in our coastal areas, because we know that the association between employment and health is one of the strongest, and this is particularly acute in our coastal areas, where those with the highest levels of deprivation also have the lowest levels of employment. And there's lots of factors that come into that in terms of seasonal work patterns and health patterns and caring responsibilities and an overall drain from employment. One of the biggest of which is again, you know, the numbers. We put together a data set of 55 priority coastal towns. They're all deprived, but they're a mixture actually of population density against employment opportunities to give us a representative sample. And just in those 55, we're looking at 1 million people economically inactive. We've got 500,000 who have no qualifications at all, and 250,000 who are already in the never worked long-term unemployed category. And that's only going to get worse if we don't have really effective interventions for our coastal areas to start to reverse this trend, and especially what's happening with young people. And it's challenging because our coasts have the half compass effect, half the area is water. It limits access to jobs, education, services, training. It impacts both on employers and residents living in the coast. And behind that, we have the higher numbers of demands, not just retirees, but there's an influx of people with more complex conditions often into our coastal areas. There are more HMOs, there's more care demand in our coastal areas. All employers find recruitment difficult in the coast. They often describe it as like being on a constant hamster wheel. It's hard to retain people, it's hard to attract them and keep them in our coastal areas. There's a quarter fewer apprenticeships actually being delivered in our coastal areas compared to urban and inland areas. So that half compass effect really feeds into those shifts that we're seeing. You know, visually, if we think about, you know, the inland labour market, there's lots of connectivity, there's more employers, we've got transport hubs, support services, there's a broader range and mix of healthcare provision. This is far, far much reduced in the coast with weaker connections, restricted transport access. There are limited options for employers and sectors to find employment in. So all of that factors into what we really need to do, which is recognise these unique challenges in our coastal areas and have interventions that are really going to help with that. This is what today's about. After the presentations, we'll have a group discussion, and we particularly want to focus on, you know, how do we make smarter use of the resources we have for the best interventions? How do we build the audience better in employment pathways and community engagement? And that's not just about getting people involved, it's active participation and really being able to use information and the tools we have to nudge people in better ways towards a more positive pathway. How do we support employers to make these changes business as usual and really implement what they need to do differently? And collectively, and I hope this comes out a lot of the discussion today, is what would a Get Britain working model on the coast really look like that works? How do we actually make sure that we're taking account of these unique coastal factors in this way and learn from each other? So we've got two presentations we're going to go into. We're going to start with Millom, and I'd like to invite Hani if he's here and I'll put the slides up for you if you let me know when you want me to move on, Hani.
Yeah, thank you very much. Yeah, happy for you to start, and it's a pleasure to kind of be here today and share what we're doing in Millom. So I think I've got 10 minutes just to talk briefly through what we're currently doing, our plans, and some of the challenges and opportunities that we're facing. You probably saw on the map there. If you don't know, Millom is obviously a coastal town. It sits in sort of the southwestern tip of Cumbria. It's in the local authority area of Cumberland. Interestingly, though, it also sits as part of the South Cumbria and Lancashire landscape in regards to the health ICB governance. What we wanted to do is kind of set the context really about Millom and some of the challenges that it's had and some of the events that it's faced over the last 10 or so years. There's four kind of key examples on that slide there. They all represent Millom as a very resilient town that isn't passive, but it has experienced issues in regards to service provision and services and assets being taken away or lost in the town. or rather the community having the infrastructure to be able to coalesce collectively to respond to local authority or health. There's 4 examples there. There was an example in 2014 where they successfully saved their community hospital, and that wasn't just about the hospital, but it's about how can that represent a key asset in the town that they can be proud of. They also experienced some challenges around sewage and flood crisis in 2017, so that highlighted some challenges around the sort of the infrastructure that they had locally. And equally, the swimming pool in 2019 was closed. And I think this highlights both real challenges in terms of those assets moving out of the town. But why we wanted to raise it today is because there's that real history of the community not being passive, wanting to kind of coalesce and come together, which has developed into the sort of the community enterprise team and infrastructure they have on the ground, which now is starting to engage with to co-develop solutions to health and employability challenges. If you can move to the next slide, please. So what we've done, we've engaged very closely, and it's fairly early days, but we've had a couple of workshops with local community organisations and public service and business organisations that live and work out of Millom to identify what solutions, good practice currently exist in the town and surrounding town, to be able to identify, is there opportunities to be looking to upscale this or look to do potentially to do stuff differently. There's a tons of stuff that we could share, but we want to just kind of bring out 4 innovative solutions that we think Millom, which is a relatively small area, so I should have said at the start, it's only around 7,000 residents in the wider Millom area, so it is relatively small. But I think what they're doing is really innovative around one idea around a reasonable adjustment passport. So this is the idea that an individual would secure that reasonable adjustment passport, which would list all the adjustments that they require throughout their career. And then if they were to move roles or to progress in an organisation, or say their line manager changed, that would follow them. So that's really important because it's around bridging the misconceptions, the gaps between potential challenges that individuals with, say, a disability, neurodiversity, a whole raft of challenges, to make sure that their experience and support that they can gain in employment is secured, irrespective of the employer. So that's really, really important. And I think it's about providing the employers with the information and the sort of the training that they require to be able to support that individual. There was that second example around a no-but approaches to interviews. So we recognise that when we're dealing with economic inactivity, roles that are being identified might not always be appropriate for an individual, particularly where they might require additional support and may require a different role. So this was the idea that organisations in the area, and identified as a particular thing that we could upscale, would identify other opportunities in that organisation or potentially out of the organisation that may be more suitable for that individual at that current time. But that's a way to ensure that that individual can enter the labour market and isn't told that that role is unsuitable and then potentially they fall through the cracks. So that's really important. The third example, and people may know of Centre Parks in Cumbria, it kind of sits quite well away from Millom. It is a fair distance. You're probably looking at an hour and a half. But there was an idea that for staff in Millom, or particularly closer to Centre Parks, that the employer would have a certain level of responsibility for paying for travel for cleaning staff and potentially other members of staff as well. And I think that's really important because when we're talking about coastal areas, obviously, as already been touched on, that sparsity aspect can often be a barrier to securing employment. So it's about how can we grow employment in the local area in Millom, but also being recognising that sometimes those job opportunities might have to grow outside of Millom, and how can travel and supporting that travel be a key aspect of securing employment. And the fourth example, which I think is probably sort of a core national best practice that we need to embed in the area when we're starting to think about this programme, how can we work around part-time working, short breaks, school time, etc., school holidays, it's probably something that the majority of us, if not all of us, have faced or facing at the current time. So it's how can we build that sort of modern working arrangement in terms of new opportunities in the area. Next slide, please. So with that in mind, so that's kind of looking back or identifying what is working well. Through that early workshop and some of the conversations we've been having, we've identified 6 key areas which could be where we focus our attention initially. And these are some of the conversations, hopefully later, will very much kind of develop this thinking. Probably the first area which we want to focus our attention is establishing a local employer engagement hub. So this is about coalescing not only employers, but key public service bodies, key businesses. We know, for those that aren't aware, there's 2 kind of key anchor institutions, or key, rather, economic anchor institutions locally. So there's BAE Systems that are in Barrow, that's around kind of 6-7 miles away south, and there's also Sellafield on the west coast of Cumbria, which is a key employer. It's a bit further away from Millom. How can we start to engage with those employers, because we know that there are a significant amount of individuals who live and work out of Millom that travel to those key employment hubs. But it's also about engaging with the community infrastructure, the community resilience team, as mentioned, because we want to do this with and alongside the communities of Millom and not impose a particular model. So that's really, really important. As part of that hub, I suppose that the following 5 ideas for local interventions are about how can that hub bring together those partners to co-develop. So that's really important to mention around how can we start to look at targeted recruitment and skills alignment. Absolutely agree with what was presented earlier. A lot of, if not all of those challenges are also challenges for Millom in terms of outward migration from the area, inward migration of potentially the potential retirees. We saw a bit of that during the COVID-19 pandemic. So how can we start to grow that local economy as much as possible and align the skills? And I think when we're thinking about the Get Britain Working Plan, we've just developed the Get Cumbria Working Plan. It's really, really important to be identifying how can we develop the skills approach in coastal areas that might be particularly unique and pertinent to those localities. How can we leverage the anchor institutions, as mentioned? So again, they're a really key part of that hub, just recognizing the size and the influence that they have over people's livelihoods and jobs and potential new job opportunities, but not forgetting that that's only one part of the equation. What we need to do is wrap around that full support. So health colleagues are particularly really, really important to that agenda. Mention about the community activation and infrastructure and monitoring and impact. I think we'll be very keen to understand today what other areas have done or are starting to do to monitor how successful those interventions could be in coastal areas. And there were a couple of key questions that we had.
Jackie's just posted those questions into the chat, Hani.
Perfect, thank you.
So these are questions, things you're particularly interested. I mean, many thanks for that presentation, Hani. It's really interesting, and I very much take on board what you said about the small size of Millom. Actually, 61% of our coastal towns are fewer than 25,000 people. So this is a really important aspect of dealing with the issues on the coast and how we actually work with small communities. So really interesting stuff. We've got a couple of minutes for any questions from the audience, if there are any, or you may want to address your question specifically, Hani.
Yeah, absolutely. Very happy to do that. So we're very keen. That first question you see on there is very keen to understand what similar approaches, interventions, models have worked really well in coastal areas. We recognise we are at a relatively early stage, very, very keen to be learning from others. Equally, what should we be avoiding? So just when I mentioned around sort of really strong community infrastructure and from the local authority, everyone will come from their particular organisation. So how can we make sure that sort of co-production is really important? The second one is very much about how can we build a people-centred approach. So recognising, and it kind of links to that no but approach to interviews as a smaller example of that wider issue. How can we bring communities with us? again, not being seen to do to them. So they might not be answered now. It may well be picked up in the wider discussion. Equally, anything in the chat, I'll keep an eye on as well.
Brilliant, absolutely. Jez, you did have a hand. It's gone. Melanie, is that a question?
It is, yes. I think I'm off mute. Yeah, thank you for that presentation. Really interesting. I've got some thoughts I can probably share offline regarding bringing communities with us. I'll cover it in my presentation in a moment, but we've implemented something in Somerset relating to our Connect to Work and Get Somerset Working activity through community-based participatory research. We've had some really good feedback from participants in the effectiveness of those conversations. So like I said, I can feedback separately. A question I do have, which doesn't align to the questions you've raised, but just really interested to hear how your engagement with employers has gone or is going, and how engaged your I suppose how open they are to discussing their recruitment and workforce type support packages that they may or may not have in place, bearing in mind certainly for our area we've got a huge amount of SMEs and sole traders, so no significant large employers.
Yeah, no, thank you very much, and we'll be really keen to follow up outside of this call on what you're doing in Somerset. On your question, I think we're quite fortunate. If you look at the map, that Millom sits just north of Barrow and then south of Whitehaven. Barrow and Whitehaven are those two key employment hubs that I mentioned that Sellafield and BAE Systems are working out of. Those two employers are really, really keen to feed into this agenda. As you can imagine, they've got significant contracts with social value linked to them. So that's certainly not an issue, but we are cognizant of, in Millom itself, which interestingly, the majority of people that live in Millom, work in Millom, the significant outward flows, but being cognizant of how can their limited infrastructure, time and capacity feed into this agenda. So we have only had a couple of workshops. I think there's willingness to feed in, but equally there's probably more we can do. So it's plus what we must really be conscious of is of those anchor institutions not necessarily dominating the conversation, because I think there is a risk they sit outside of Millom itself of only exacerbating the outward migration. So the key focus is about building Millom from within. But it's certainly not a thing with fixed, but I think it's just that continuous engagement with local employers. Equally, if you've done anything that's really focused successfully in on that, or anyone else on the call, I'd be really, really pleased to hear.
Brilliant. Amanda, you wanted to come in?
Yeah, I just wanted to sort of come in from a DWP perspective up in Cumbria. So Millom lost its job centre years ago when there was a lot of sort of the smaller job centres were shut down. From a DWP job centre perspective for our unemployed customers, we saw that there was a requirement that we had a footprint in Millom. So we currently deliver in Millom 1 day per fortnight from Millom Community Hub, and that's sort of bringing the community together. We've got a lot of sort of interest that the customers attend their appointments, so they're not having to travel into Barrow or do it over the phone or video or anything. So it's that face-to-face contact. We deliver 50+ sessions, so looking at sort of the older workforce, because the demographics show that it is an ageing sort of population in Millom, but we also look at supporting the youth as well, and also health. Health, as you've mentioned, Hani, is a big sort of issue, and with the sort of the reasonable adjustment passports and everything like that. We do have a van, a mobile van that is a pilot in Barrow at the moment. So again, we are looking at outreach where we could look at sort of key areas where we can go with the footfalls there to support. And that's got funding until March next year. On the employer side of things, we are working closely with Haven, and we're in discussions to see if they can do the same model as Centre Parks do. So to put on transport for any staff that they take on from Millom, but again, it depends on the volume of their workforce that they take on in that area. And again, I'll pick up with you sort of offline. We are working with Team Barrow and Westmoreland and Furness around an employer strategy, because there is so much going on in the employer world at the moment, and the support that's available to them. And it's everybody's trying to get in contact with them, everybody's trying to engage with them to sell different things. So that's something else that I can pick up with you outside the call.
Brilliant. Thank you. I'm going to move on to our next presentation. Mel, this is you, yes?
It is, yes, thank you.
If you prompt me when you want to move the slides on.
Thank you. Yeah. Hi everyone. I am Mel Thomas. I work for Somerset Council, but I do work quite closely with the Somerset ICB as the Work Health and Skills Lead in Somerset. So feel that kind of arrangement joins up the local authority with health services quite nicely, and certainly benefits us in taking this project forward. So we are relatively early, although kind of 4 months in, but we are at the moment still trying to find our feet in terms of how we want to see this project rolled out. So we are focusing on reducing, it says reducing employment and health inequality in Burnham and Highbridge. So as I said, I'm based in Somerset, so Burnham and Highbridge are probably 20 miles south of Bristol, and 20 miles north of Taunton, which is our key market town in Somerset. I think some of the challenges that we see in the Burnham and Highbridge area are consistent with the wider county. We've got an ageing population, significant levels of outflow of young people from the county. We don't have significant local major employment hubs, and I think kind of transport and connectivity across those rural areas is really challenging for the whole of Somerset, but that's exacerbated, I think, probably in our more rural and coastal areas, of which Burnham and Highbridge are part. So if we can go on to the next slide, please. So just to set the context for Burnham and Highbridge, we have a resident population of just under 20,000 people. We've got 21% of that population who are of working age and are economically inactive. We've included Highbridge in our geography because for us, they are very close to Burnham, literally a couple of miles down the road. But as a community, they see themselves as that single community of Burnham and Highbridge. But we do have quite differing challenges in those two communities. So Burnham, we have a slightly older population and certainly some more affluence across that area. We are located just off of the M5, so that is quite attractive for that inward migration of the older population moving out of cities and so on into the area. In Highbridge, we do have certainly higher levels of deprivation, unemployment and economic inactivity, and I think certainly a lot of our fit notes are probably distributed to individuals who live in Highbridge. So we thought it was really important to look at that whole community as a single area. So as it says here on the slides, we have issued, or our doctors have issued 907 fit notes just in this calendar year so far, and that was as at mid-March. So we are seeing an increase in those fit notes that are being issued. Certainly we'll come on to the details later, but certainly a lot of those fit notes are in relation to work-related challenges, so poor mental health, anxiety, and so on. Next slide, please. So the aims of the project, like I say, to reduce economic employment and health inequality. we want to look at reducing the number and duration of fit notes issued. We want to support individuals to remain in or return to work. That will mean, close working with our employers, hence my question just now. Want to strengthen the collaboration between health, employment and communities with those employers. We are finding we have a lot of support available in the area, but it's fragmented and it relies on the individual navigating their way around the support available to them. So we want to try and bring that together under one roof and be able to signpost individuals across different services whilst hiding the wiring for them. And then given where we are financially in terms of investment on this type of activity in Somerset, we're not part of a mayoral combined authority area. We haven't been part of the WorkWell pilot activity, so we are seeing significant loss of funding on this type of activity in the area. So we're really keen to develop that return on investment case to support any ongoing activity we identify as a result of this project. Next slide, please. So at the moment, as I said, we're still in the early part of the process in terms of analysing the data. We have Sally, who's on the call, who has been seconded to us from one of our GP surgeries to help us analyse and get under the skin of the fit note information and try to establish kind of those patterns, what the key reasons are for people being off work. We're also working closely with our DWP colleagues to understand the claimant data. As per Millom, we don't have a local job centre in Burnham or Highbridge. That closed, I want to say, decades ago. I don't know the time frame, but we haven't had job centre presence for quite some time. Our nearest job centres are either in Bridgewater, which are around 10 miles away, or Western Supermare, again 10 miles north. So actually access to job centre support can be quite limited for some, particularly given the transport constraints we have in the area. So we are working with our JCP colleagues to see how we can get some provision available. Again, we have a community employment hub or hubs in the area. Due to the lack of funding, they will be starting to wind down. So I think our biggest challenge will be the loss of some of our services before we can start to ramp up and bring back the services that we know those communities need. And that's part of our asset mapping work. We've got a really good presence of the community and voluntary sector in the area, so it's us getting out, understanding the services that they offer and how they can align to our health and employment services. We have started a conversation to bring DWP employment advisors to work out of our GP surgeries. Very early stages of those conversations, but we're hoping that we can take that forward, and that will enable individuals who have requested fit notes for us to be able to offer that back to work conversation that isn't currently happening due to capacity constraints within the health system. I mentioned as well that we have a good model for community-based participatory research across Somerset, and we've done a piece of work to help support the development of our Get Somerset working plan and the implementation of our Connect to Work programme. So we would like to replicate those community discussions at a very local level for Burnham and Highbridge, and bring those voluntary organisations in for a conversation, but to also engage directly with individuals with lived experience As I said earlier as well, we've had some really good feedback from those with lived experience to say, you know, how they appreciate those early conversations, how they appreciate that we're listening to their concerns and using their feedback to inform whatever the interventions we plan to put in place. Employer engagement is a key piece of work that we want to tackle next. Again, I mentioned earlier, we don't have any major key employers in the Burnham and Highbridge area. We do, however, have Hinkley Point, which is the nuclear site based out in West Somerset, which is around 20 miles from Burnham and Highbridge. We also have a gigafactory that is currently under development in Bridgewater, around 10 miles out of town. So we are working with those employers to see what opportunities for the workforce will be. But as per Millom, we would like to try and encourage our local employers to create opportunities for our local people. So we do have a first employer event organised for the end of April. We're not seeing a huge amount of take up of that event yet, but we will be going around knocking on doors to see if we can get employers involved in that conversation. And I think really the purpose or the main objective of that first conversation is for us to hear from employers what their key challenges are in terms of maintaining a healthy workforce and you know, opening up and rethinking their recruitment practices. And again, that's a conversation we're having across wider Somerset employers as well, in the hope that, you know, that will align closely again with the Connect to Work programme. Yes, we find breakfast helps as well. So just some data insights. We've got almost 45% of our universal credit customers who are on a health journey, so would fit into that category of longer term health and disabilities. 39% of the fit notes we're issuing are related to work related issues, anxiety and stress. So again, bringing employers into these conversations, really key. Somebody said earlier on the call, we are very aware that employers are being challenged at the moment, not only through the cost of employing people full stop, but conscious as well that employers really are keen to make sure that they can operate as a business. So opening up opportunities to individuals who might not be or have the right attitude towards work, we know is going to be a challenge for us. Next slide, please. So we're probably all familiar with the stat that you know, 20% less likely to return to work if you've been signed off of work for 2 weeks or more, and those stats increase the longer you're off work. So we're really keen to look at how we can implement early interventions, either before a person or an individual requests a fit note or as they are issued their first fit note. And we believe as well that those early interventions don't have to happen through the health system. So ultimately that will support capacity in the health system, which we know is very stretched. So we want to try and look at ways we can bring our voluntary and community sector into delivering those early interventions. Next slide, please. So we are coming up against a number of challenges. I should imagine most areas have the similar challenges. So fit note data is inconsistent. It doesn't necessarily provide all of the information that we need to help determine those interventions. So we are working closely with our GPs as to how we could look at the data collection and reporting against fit notes. The current process isn't fit for purpose. Given the capacity constraints on our health system, it's relatively easy to request a fit note, and that's signed off without having that conversation as to whether a person is fit for work or not, or partially fit for work. So we want to look at how we can review the process, bearing in mind we've got national constraints on that as well. I've already talked about GPs not having the capacity for those meaningful conversations, but equally, in some cases, it's not probably relevant for the GP to have that conversation. So it's about the GPs understanding who they can signpost the individual to for the right support. We're seeing a lot of older women in the 50 to 65 age category. I'm in that category as well. So when I say older, I don't mean over the hill, but you know, we're all still capable of working. So how do we support women in those age categories to stay in work or find work? I've already talked as well about early intervention. How do we put in place those interventions to prevent the issuance of fit notes, and then working more closely across the neighbourhood. Like I say, we've got plenty of support available, but it's fragmented. How do we bring it closer together? Next slide, please. I'm not going to talk through all of these challenges, but one of the key challenges I do want to flag, again, it's down to health capacity. So particularly given that we've got a significant number of individuals with fit notes with kind of mental health concerns, we do have long wait lists for example, talking therapies. Certainly we're looking at probably 6 to 9 weeks just for an initial contact with those services. So that will create problems for us in terms of being able to implement those early interventions. We do have good social prescribing across Somerset, but again, it's fragmented. Our social prescribers aren't necessarily cognizant of all of the support available in the area. So that's certainly something we'll be doing through our mapping work to put together kind of a directory of support available to our local areas. And then that last box on there, unintentionally incentivise sickness absence. Like I say, it's easy to request a fit note, but not easy to get the conversations and support an individual might need in place.
I need to hurry for the end, Mel.
That's fine. I've talked about all of this anyway, so I don't need to cover this slide. I think that was the last one.
Brilliant. Thank you.
Thank you.
Thank you. Excellent presentation. Really, such a key issue, the fit note one. I know it's a national issue, obviously, but it's particularly pertinent on the coast because we have fewer GPs. They're under more pressure. And that distribution of health resources on the coast that the Chief Medical Officer raised in his key report really plays into these issues and the capacity and pressure on our primary services in the coast. So it's really important to see interventions that work around this. I've just put the questions up again. If people could have a think about these, let's have a discussion around what you've heard. If anyone's got any specific questions for Mel, please put your hands up now, but also any general comments and questions, be really good to start to hear from people. And those questions are in the chat. Where's my Hani?
Yeah, really helpful presentation. Thank you very much, Melanie. It was just a question around how have GPs responded to that, because I'm conscious if the system as it stands doesn't really incentivize them to change it, other than wanting to see individuals succeed and go or stay and work. So how have they been fairly amenable to change in that situation?
I think we're seeing certainly our GP practices are engaged in the conversation and want to consider how we can support patients. I think that the key messages coming from GPs, and I've heard this through national forums as well, is that they are a patient's advocate. So if a patient is saying that they need time off work, then they would take that as that individual needing time off work. I think certainly through early conversations with GPs, there is the idea that actually they can't solve the issue if the benefits and welfare system continues as is. It needs to kind of be a hand-in-hand systemic change, I think, and I don't necessarily disagree with that. So we haven't dived into the detail of conversations with our GPs yet. We want to make sure that we've got an indication of what the challenges are and potential solutions before we, like I say, dive into deeper conversations as to how we can look at local change.
Excellent. Amanda.
All I was going to say, I'm not sure whether anybody's on from Lancashire and South Cumbria ICB, but Barrow Millom area were part of the Work Well Vanguards. So they piloted Work Well last year. So that funding's coming to an end and we know that it's being rolled out nationally. But they got some innovative funding to come up with an idea, and what they've done with their health and work coaches, Melanie, is actually start to upskill and work with the GPs to upskill them around fit notes and what actually the impact of issuing a fit note to somebody can have on that long-term sort of being economically inactive, getting onto universal credit, getting into that sort of regime where they don't have to look for work and things like that. So a lot of it was about the re-education. And as I say, I'm not sure if anybody from the ICB was on, but I can possibly get you a contact to get in touch with around that and to see sort of what their sort of results are starting to see. But it was a one-off that they were doing around sort of GP re-educating.
Yeah, that would be really interesting because that's something that can be done within the limited resources we've got. And like you say, it's about kind of raising awareness of the impact of those decisions made now, but longer term impact.
Longer term, yeah.
Catherine, and I know you've been putting some interesting things in the chat on this as well.
No, it was just to say I wondered if it was something that the CNN could maybe coordinate a sort of briefing for us all about different places' experience of the fit notes and changes that they've made, because it'll definitely impact all of us and we could all learn from each other. So I seem to remember Fleetwood had done something transformative with this.
And people are at different stages with it and trying different things. I know in the chat you were talking about where they rely on or you get a different impact if they actually speak to the person on the phone. I think have you seen some of that as well, Mel?
Sorry, I've muted myself. Yeah, I think, like I said in my presentation, the current system and processes incentivizes issuance of fit notes. I think if we were to offer a conversation ahead of confirming or providing a fit note, I think the outcomes would be quite different for not everyone, but certainly a good handful of people coming through.
So sorry, is that the idea that you'd say that the receptionist would say to the GP surgery would say before you can see the GP you need to go and see X person?
Yeah, so what we're doing in the very short term, certainly for our local GP surgeries, we use an online system called Ask My GP. I'm not sure which other areas use that. So the expectation is that any fit note requests would primarily come through that system. So it's not even, you don't even need to speak to anyone ahead of requesting that fit note. So what we're trying to do is offer a voluntary conversation with those patients requesting a fit notes, and that's the purpose of getting the DWP employment advisors to work with us out of the surgery. So we're kind of offering that holistic package of support and conversation out of one place.
With Julia Nix here from DWP, who's our kind of DWP national representative for the CNN. So thinking about Catherine's suggestion about what we can do more broadly, maybe not just about fit notes, but about some other issues. I don't know if there's anything you'd like to comment on, Julia?
Yeah, thanks, John. I mean, you're doing all the right things. It's just how do we bring it together as a multi-agency approach, isn't it? And my other DWP colleague, that's what we're trying to do. I'm very fortunate that I did manage to keep my job centres. I fought hard to keep my small job centres. So I have got small job centres in market towns. But once you've lost that, it's how do we support and put that back? I'm also a great fan of social prescribing. Often people see that you've got to be recovered before you go to work. Often part of the recovery is the right form of work. So that's what we've got to try and get across. The other thing, John, that I found really helpful is it's very rare that I find an employer that wants a young person to start off their lives on benefits. And if you talk about as bluntly as that would you, if that was your son, your goddaughter or whatever, you know, is that something you'd want for your young person? And we can engage. They do like at the moment work trials and work experience, so they'll give it a go. I think it was Millom that said the no but approach. I've got employers that don't even interview our young people now. They'll just take them. They'll give them a go. Some work out and some don't, because they've worked out that if they do an interview, some work out and some don't. So they might as well just try them. And then some of them have been very pleasantly surprised, because at interview they might have done well, but they didn't work out. But those that didn't do well at interview have worked out really well. I think it's just bringing us together, John. We just need to work better together as a multi-agency approach.
Absolutely, and it's been really good already to hear some of the people connecting with each other, talking about, you know, linking up afterwards, because it's the networking aspects of the CNN that's really powerful. Kevin, you wanted to come in.
Yeah. Morning, everybody. I'm going to give a Basildon example, and if you don't think that's coastal, from exactly the surgery area that this is in, you can see right across the Thames estuary to the Isle of Sheppey. So it's close if it's not coastal. We had some sort of test work. I wasn't directly involved in it, but a lot of the feedback, and this is one of our very disadvantaged areas, was that GPs didn't necessarily see it at their role and equally that they felt compromised around the patient trust side of things. So, and it's kind of not helpful when the chair of the Royal College of GPs is on Channel 4 on the very day we launch Fit for the Future, challenging whether that is the right space for GPs. So I think, you know, yeah, I'm kind of very interested. What's the alternatives that are close enough to GPs that will get us the result that we need? So I just wanted to land that one in. And I think the other component often, and of course I would say this with the Foundation Trust logo behind me, despite the fact that we are in desperate trouble as a trust, as I'm sure some of you will have seen on the news quite recently. But much of the wait and this delay in getting people back to work is often due to they require a view from the hospital, because it may be requires a secondary intervention. And there's a point there about how do we get really into the weeds of that, so that our GPs do have enough confidence that the guidance and support they've got, even if it isn't the valued secondary opinion, is quite the right one. And I've just been working on the development outline of our Work Well plan in Essex, and you know, I'm ever the optimist that the MDT type of arrangements might deliver on some of that, but being cognizant that we also have that challenge, I think is quite important to whatever we design and develop. Thank you.
Thank you. Absolutely. The other thing that struck me both with Mel and Hani's presentations was the mention of older people in the workforce, and I'm really glad to hear that, because we increasingly encounter the needs for employers to recognise 50 plus in the workforce. They sometimes want different things. We're also hearing a lot, particularly in some of our coastal areas, that this is a group who are falling out of employment quite rapidly. And so efforts around that age factor at the other end, other than youth, I think is really, really good to hear and really important. And I know, Kevin, that's possibly a focus of work that might come about in Canby Island.
Indeed, it could be, but sorry to stick my hand up again, but I had another almost not a left field thought about that age group, because I wonder if what's underneath it is an opt out of work because they need to care for a parent who's becoming more elderly and frail. And actually that kind of thinks about this flexible model of work, the part-time piece. So you kind of, at one end, you've got school age children needing care, and then at the other age, you've got older people for whom the care is not necessarily easily available. And I know that that's particularly nationally a challenge for teachers. So when I was closer to the education sector than I am now in that respect, that was a lot of the given reason for teachers leaving that career choice. So that may be playing out in other areas of our world. And of course, what you present with the coastal part being a rising demographic of older people, and we absolutely know that in Southend, that could be something that thinking about the symptoms, or is it the other way about, thinking about the cause rather than the symptoms, might also help us.
Absolutely. Mal.
Yeah, we're seeing similar again across Somerset, but in Burnham and the High Bridge as well, that quite a large proportion of our economically inactive are people who have caring responsibilities, or in the older age group have taken early retirement, and due to the cost of living are now looking to go back to work. And again, I think it's kind of really important that we get employers thinking about kind of that older age group and the skills and experience they can bring to the workforce. And you know, if we can encourage that flexible working arrangements, and similarly to, you know, those employers who are offering work trials to the younger age group, there's no reason that same model couldn't be applied to the older population who don't necessarily have all you know, up-to-date recent skills that employers are looking for. But there are opportunities that we can put in place to upskill or reskill those individuals to meet employer demands and needs. We just need employers to engage with the conversation, so we know what their challenges are and how we can support them to address those challenges.
Absolutely. Laura, you've put an interesting comment in the chat about movement to work.
Yeah, it was just on the back of Ian's comment there, just around the Prince's Trust scheme. So yeah, we have 3 cohorts of movement to work into our organisation, which has proved really successful as well. We've been running with movement to work for a number of years now, and that's just grown each year. I think we started off about 10 years ago, I think, with 1 cohort, and that's now grown to 3.
And do you want to say a bit about your organisation, Laura?
Yeah, so I'm here representing BAE Systems in Barrow.
So I think, you know, sort of BAE is a really good example of a major employer that's engaged with, you know, our coastal issues. And we do have, yes, you know, the traditional pattern of coastal areas is they've lost employment, but we actually at the moment do have some key areas with major investments and developments happening and opportunities for work. So it's really important to think about some of those aspects.
And I'm furiously writing lots of notes here in the background as well, just picking up on all the comments and sharing, conscious that we've not got Team Barrow representation on this call today. So yeah, I've got a lot of questions to go and find out the answers to as well. So we can pick that one up. Is Jed still on the call? We've got
he's here, yeah. So that'd be really good.
I'm here, Laura, yeah.
And Gemma, it's really good to see yourself from Whitehaven. And I know we were talking there a bit about the older age group, but you've done some fabulous stuff with engaging young people on employment pathways with the Levels programme. I don't know if you want to mention that at all.
Yeah, so it's actually grown arms and legs quite a bit as well. So Levels itself was very much about increasing engagement with young people, really focusing on raising aspiration levels and sort of awareness around broader career paths and things like that. But off the back of that, we are now working very closely with Sellafield and their supply chain and a range of other organisations, including DWP, skills delivery partners and things like that, to actually the ultimate aspiration is is to have better coordination, but also recognise that a big challenge in the skills landscape is sustainability for delivery partners and things as well. So by and this is a real benefit that we're having right here, and I know Hani, you touched on this with where Millam's location is with the key employers, is that you have a lot of money coming down the line that can be pumped back in some way, shape or form. So this is really about a very coordinated approach, but that lives beyond the frameworks, even though they are very long. So at the moment, we have problems whereby supply chain companies will create a program themselves as part of their commitment, etc. That framework will run out or whatever, it will just go away, or it's not a very good program because they're not necessarily the best people to create that. So really getting into those issues and just improving overall coordination. We're at a very early stage with that, but big aspiration around making sure that all secondary school pupils have a meaningful work experience, engagement, things like that. So, you know, very much focusing on younger people to arrest so some of the challenges, you know, hopefully reduce the NEET rate and stuff. And for me, one of the interesting things that's come out of that more than anything is we've had some amazing programs. Cumbria Youth Alliance in particular have been doing some amazing stuff, and they're able to evidence it very, very well. They've developed their own impact measurement tool that we're all going to use going forwards, and it's person-centric, so it's an assessment of the person. And they've had a lot of support from Lottery with that, but then it's hit a 5-year point, and that's the max that Lottery can fund. So we're now seeing an increase in the NEET rate literally straight away. So the sustainability aspect's really important. The coordination is really important, and the accountability to each other and to people in our area and stuff's really important. So look, it's an early start of a journey, but I think the collective impact of those things is what's going to be really, really exciting over the long term. And removing the competition between delivery partners is key in that as well.
Absolutely. Some really, really innovative stuff. We have, if there's no more questions right now, we'll come back to the discussion, but we've got a presentation from JP from Can Digital. And Can Digital have been working with a number of our partners around the CNN and coastal areas, and have a really interesting and innovative approach to that audience amplification and growth of different ways of reaching people. Can I hand over to you, JP?
Yes, thank you so much, John, and thank you to Hani and Mel for your presentations. A sort of beautiful handover with those two presentations, and then Julia, Kevin, and Gemma's contributions at the end. I wanted to talk a little bit about how we can help you scale these programs, both connection and reaching more people, and participation from individuals, but also from businesses. I think a lot of what we've heard today is about brilliant one-to-one or one-to-few interactions with GPs, with people in job centres and things like that. And that's something our brains, our human brains, can really understand and process. However, we don't have the innate ability to really sort of understand the scale of what we need to achieve. For example, if you guess how many people are in that heart-shaped crowd, we almost never get the right answer, which is 1,000 people. But in your normal primary care network, there's probably 35,000 people. And when you're looking at the county level, there could be many hundreds of thousands of people who fit into that either NEET, low income, 50 plus, not in work cohorts. So how confident do we feel that we can scale these programs to reaching that many people? And that's why we've partnered with BBI and the CNN to help you do this. Scaling is really important, because if we don't scale, then we exclude people. The impact of the programs goes down. The savings attributed with the programs funding, their raison d'etre, don't occur. The cost actually goes up, and then the programs don't become sustainable so that they can last beyond whenever the funding stops. Or to put it another way, if we scale things properly, we include everyone, impact accelerates, the savings accelerate, the cost goes down, and sustainability goes up. Primary reason for doing that is more people have better lives as a result of what we're doing. So scaling is important, hopefully. But how, with our limited budgets and limited numbers of people, can we do that? Well, I wanted to move from that kind of guttural anxiety and panic towards what's behind John's head, which is this idea of hope, and hope in things we already have in the public sector. We don't need new things. We don't need to make vast investments that we know, frankly, we're never going to have the money to get involved in. So in order to understand that idea, I just want to explain quickly that, you know, we're a public sector campaign specialist. We partner with BBI in lots of different locations. We've generally run 4,000 campaigns plus, but we are absolutely obsessive about data evaluation and business cases, particularly live evaluation as campaigns run, and connecting communications to outcomes so that we can reduce the cost per outcome, which means more outcomes, but it also means a greater chance of sustainability. And when we look at where the residents are in scale, in Somerset, in Cumberland, in Essex, we can start to see where, considering these different audiences, where are the places that we need to be in order to scale interventions. And I'm going to quickly talk to you today about a concept called remarketing, which you no doubt will have experienced, but probably don't realise its application in this field. And then start to try and connect the intersecting barriers to work, many of which have been addressed here, the intersecting channels and audiences, and then the intersecting campaigns that are already running in the public sector, and some examples of how we can bring that all together. So have you ever looked at something online and then started seeing ads for that thing everywhere else, on social media, on news, be it a holiday, be it some sort of retail, something you were going to buy? Well, that thing kind of creepily following you around the internet is remarketing. And it relies on you landing on a web page, accepting cookies, and then that organization choosing to pay to put an ad in front of you on various social or news platforms. And we at CAN have been taking that technology and using it to nudge people into becoming foster carers, or to give up smoking, or to increase the amount of physical activity they take. So they look at a web page once, and then we bring them back to that web page, but maybe also other web pages that might be relevant. So if I've looked at a smoking cessation web page, I might also be interested in having a lung check or a leisure centre subscription because I'm trying to improve my health. So this idea of remarketing is really powerful, and it's probably the most effective digital strategy you can deploy in order to scale. So how do we apply this to some of the things we've been talking about? Well, if only we had a way of targeting these intersecting barriers to work, to employment, mental and physical health, a lack of skills, training and support, family responsibilities, children, but also unpaid care responsibilities, the availability of willing employers, transport as a huge challenge, particularly in rural or coastal areas. Well, where is that remarketing audience? Well, you might be surprised, you've been building it for years on these sites. So in Humber and Yorkshire, Cumberland, Essex, Somerset, there's content for business, content for people looking for jobs, support for people who are struggling with the cost of living, and even support and access to services around mental health and well-being. And it is very common, in fact, most of the sites there have an advertising remarketing pixel on those pages, which means that they've been sitting there building audience, which you can now tap into. So hopefully that gives you a sense that already within your existing websites are audiences that you could use. So when we ask the question, how can we engage and reach people more? The answer is actually in things you've already got. So taking that idea of remarketing to people that have been visiting your sites, yes, we can remarket to sites, but councils are the biggest media owners in their areas. They have free advertising space across out of home, on websites and in their e-newsletters. And that can be used for free to reach and engage people and bring them into some sort of program, some sort of user experience. As you can see here in Kent, Social Enterprise Kent were using that, plus also targeting around news, on search platforms, on Snapchat to reach younger audiences, and on Facebook and Instagram, to place in front of people who are looking for roles or looking for jobs, and also in front of low-income households, the opportunity to get free training in adult social care. So this is something that BBI and the Coastal Navigators Network set up in Thanet, and so far 17 people have started the course, but 105 people showed some sort of interest. So this is that example of how you can go from audience that's been built using channels to engage thousands of people in this instance. I mean, this reached about 200,000 devices, and for a very low cost, achieve a growing workforce in adult social care in a certain area and a reduction in unemployment in coming years. So if we look at these intersecting barriers to work, I also want you to think about the intersecting public sector campaigns that the public sector will already be running in mental health, in physical health, skills training and support, family responsibilities, employers, and transport. So we've got websites that are building audience, but we're also probably running outreach campaigns. For example, in West London, there is a campaign targeting people who are typing in problems with bailiffs, struggling to sleep, all of these things into search, and then connecting them with third sector mental health charities with a particular skew towards men. So there we've had 15,000 interactions for a mental health campaign funded by Public Health, but those people could be remarketed to and brought into a Connect to Work style program. In Lancashire, we had our friends in Barrow talking about the move to work. Well, as part of the public health prevention agenda in Lancashire, they were encouraging people around World Heart Day to take steps in local leisure centres and local paths to exercise more. About 133,000 people from low-income households interacted with that campaign in various parts of Lancashire, and that audience could also be remarketed to and brought into an array of different interventions. It could be smoking cessation, it could be skills, training and opportunities to work. In Surrey, people who are searching for issues relating to long-term mental and physical health conditions were given ads to get support into applying to work with an array of DCSEs. And they had around about 1,500 referrals, 52,000 interactions. All of those people could be, again, continually nudged towards various support. Hopefully you're starting to see a theme emerging here. In Redbridge, we were targeting parents of young children and encouraging them to attend this thing called Mini Explorers, which in itself started to pay for itself because of increased use of this thing. Hello, Kevin. And but also that is an audience of young parents from low-income households who in that area could be targeted with support for parents into work. This was a campaign run in Milton Keynes, targeting people on Snapchat and TikTok, helping them identify as unpaid carers and connecting them with opportunities to get training in social care and, again, more opportunities for work. And what this did also was we measured before and after the campaign, do you think there are opportunities for you, young folk, in Milton Keynes? And pre and post the survey, we were able to increase the perception of there being opportunity for them. So there was positive impact beyond just the applications for the courses. We talked about getting employers involved. Well, there are other campaigns targeting employers, like Living Wage, and we'll talk through some others. So again, there are audiences and there are business rates pages that we can use to amplify and engage employers at significant scale, not on necessarily a person-to-person individual contact Where you do that, we've seen campaigns like micro providers. I don't know if any of you are familiar with this idea, but you target local small businesses and encourage them to help grow their businesses by offering adult social care services. So this campaign in Surrey has had 29,000 interactions. Lots of local businesses there may be socially motivated to support adult social care, may be also open to some of those things that Julia was talking about around offering job opportunities to young people, or maybe people at the other end of the career spectrum. And there are lots of ways councils can incentivise these organisations to help. But you don't have to start from scratch. You're probably already running campaigns like that that are engaging these audiences at scale. Once you have those interested employers, BBI and Surrey ran an Anchor Employers programme to get people applying for roles with organisations like Active Prospect, which is an adult social care provider, and also Freedom Leisure, a local leisure centre provider. So these connections then started accelerating the outcomes for these organisations, which then make health and adult social care more sustainable in those areas. So these wonderful connections through these programmes mean that cost per interaction goes down, cost per outcome goes down, and they all become more and more sustainable. We talked about transport at the combined authority level, or local authorities run transport too, but when you're running a transport consultation, or you're promoting low bus fares, or you're trying to encourage young people to use buses more, you're again building audience, which you could then offer them training or work opportunities as you go. So this idea of people who've interacted with campaigns previously, you can remarket to. You're probably building audience and you don't even realise it at the same time. And based on this, there would now be many tens of thousands of people that you could reach for very, very small amounts of money and bring into a range of interactions. So just to summarise there, scaling is getting much, much easier and cheaper to do. Sure why my camera's turned off there. But councils have loads of free media, which if you ask Comms and Web, you'll be able to use to promote and scale your programs. You can reach the right people, not by spray and pray marketing with radio, TV, out-of-home buses, right, which is always a waste of money, but by using those channels and using those audiences that you've already built. And then if you reduce that cost per outcome, you get more outcomes, which makes the business case for sustaining investment in your programs much, much easier to make. That is the end for me. If anyone has any questions, you can ask now, drop me a line, but I'll hand back to you, John.
Thank you, JP. Fascinating. I love this idea of audience building with that nudge capacity to it, and actually, especially, we put this up as one of the core things. How can we make smarter use of existing resources? And I think you've really highlighted a good example there. Does anyone have any questions for JP?
Clearly, it was all clear then.
Kevin.
JP, hi.
Hi.
Can we just define what we mean by outcomes here? Because I'm a little bit anxious. We can drive demand, but if we don't have the supply of jobs, actually what that ends up with is people walking away saying, well, that was a road to nowhere. And that's almost what we don't want to have happen. So that totally would just agree. Be my question.
Well, I absolutely agree. We had a similar experience with the Green Homes Grant many years ago. Great idea. Lots of people applied, but there weren't any installers. And it was going to take about 2 to 3 years to train the installers to that, which created a lot of disappointment and frustration. And so we 100% agree. That's why where BBI have been engaged to engage employers first, the programs have worked incredibly well. And we are recommending that in delivering Connect to Work, you don't think first about what you're doing already. You think first about employer engagement in the local area. And it is much easier to do than you think. So there are also intersecting programs with employers. And again, we found the team at BBI very good at bringing them together. and putting in the right processes and capacity in place in order to be able to then start bringing more and more people through to them.
Yeah,
but yes, very good point, Kevin.
It is, and it is really, you know, it's not a standalone kind of intervention, and it very much does need to be linked into other elements of what we're doing that works. I mean, Vicky, I don't know if you want to comment from Lincolnshire's experience, where this is one of the widening access demonstrators programs, but Vicky's also sits on the local Connect to Work board. And a lot of that focus, and similar in Kent, where JP was also involved, has been around the employer brokerage side of things, alongside different ways, digital, but also things like community connectors to reach people more effectively and keep them engaged. I put you on the spot, Vicky, but
no, I think we've learned that it is a little bit of a pick and mix. We do need to do a little bit of everything because of the individuals, especially with the widening access. Although we know we have many people who fit that description, while widening access is based in Skegness and along that coastal strip, but actually getting to the specific individuals we need to, we've had to use a number of outlets. So we've had to use trusted relationships. We have used digital. We have used other outlets because of, it's easy to say we have a large number of these individuals in this area, but actually to get that trusted relationship and get them to engage with us, we've had to use multiple routes to be able to get that trusted relationship, if that makes sense.
Absolutely. Ian.
Yeah, I'm just wondering, because if I've picked it up right, what you're talking about is getting more traffic to look at services that are being offered, as it were. Is there a scenario in which that could help, going back to where we were earlier, in terms of people are not right for one role, but could you consider a different role, or kind of getting people to think about themselves? I know you said about, you know, thinking about becoming a foster carer, and that's kind of probably akin to what I'm thinking, but yeah, how would that work?
100%, Ian. Very, very good. It's like the question there. So this idea that in the recruitment world, they call them talent pools, where you've got people who've expressed an interest, a need for work, and then you get them to subscribe to support and a feed through email of multiple opportunities over time. Just because they've expressed interest in that thing and that hasn't worked for that, you don't need to shut that person off at all, and you shouldn't. This idea of building employer brand, identifying the barriers that they have to work, maybe going through one application will highlight those barriers, but the idea then of engaging people at scale, and then for the recruitment point of view, you improve employer brand, have people who then, when they are employed, the retention increases because they understand where they're going, they've had support to get there, which also is very valuable. It's not just about getting applications. You want the people to stay in role as an employer, but also as a system. So going a little bit further up the sort of, if you think of the marketing funnel, which I think is exactly where you were thinking, we're getting people into active consideration, and then we're gently nurturing them with multiple opportunities, and finding the one that fits for them over time. If you give people multiple choices, the net number of choices taken increases. So getting people to that point, and digitally, you don't need to do this with humans, because that's where the capacity issue really kicks in. But you can be prepping and bringing people through to, yes, as you said, not just one, but many different ideas. And this approach was deployed in Surrey, where there were 5 initially, but hopefully that number will increase, anchor employers who all experienced, really big increases in applications for their role. I think, yeah, the Animal Plant and Health Agency had 92 submissions to one of these light touch landing pages, which just sort of explained a little bit about what was there, and then took a minimal amount of information from that person to then add them to that list and build that pool of people who are speaking to them. This is incredibly valuable to employers, as Julia will may hint at.
Thank you.
Perfect.
Yes, Julia.
Perfect segue. Thank you, JP. All I was going to say is I haven't managed to convince this employer to just not interview anybody, but what they are, and they're in the hospitality industry, and our coast is full of hospitality, so they're absolutely struggling. So what they've been doing, and it's working so well for them, is two things. And JP, you're right, it's the match. We've got to have the supply and the demand. We can't have one or the other. We just disappoint both sides if we, so it has to have both. So this particular employer, so Blakeney House Hotel, big hotel, very popular, has decided that they will interview them, the individual, but they will find the job that suits their talents. So they don't say, I want, so they look at them, and sometimes they've said that they've wanted to do a bit of reception, a bit of chambermaiding, and a bit of something else. And the other thing they do, because they're rural and they're remote, they allow the individual to stay the evening that they're on a late shift. Oh. It's not a home, but they are permitted because they can't get transport home. It's working really well for them.
Of course it would. That's ingenious.
It's what we've all been saying. All of the presentations had that flexibility, isn't it?
Yep.
If you really want people and you want to keep your people, you need to be flexible, and the person needs to be flexible as well. The job seeker, as we call.
Yeah. And Julia, there's Andrew St Ledger in Suffolk, who I'm pretty certain would love to hear about this at the county council in order to use. He's in the comms team there, and I'm sure he'd be very happy to support whatever you need in that area.
I'll reach out. Thank you, JP. Thank you.
Mal.
Yeah, I like the sound of that as well. It'd be really good to capture that in a case study that we could have a look at. My comment relates to, sorry, I can't remember who mentioned it, but about the trust of individuals. I think certainly we found through some of our campaigns or programs is that individuals do not trust the public sector. They don't want to engage with the council. They don't want to engage with DWP. So I think some of the marketing that we've just been talking about would reach to those individuals who are probably on the verge of engaging, but I don't know how effective that would be to those who are totally disengaged. So I think, you know, certainly something we'll be looking at through Burnham and Highbridge is how can we bring our voluntary sector, who probably do have that trusted relationship with those individuals, just to get them over the line of engaging, and then we can kind of bring them into whatever programs or interventions we've got. But I think some of those individuals, certainly who are economically inactive, been out of work due to disabilities and so on, are probably quite far from the labour market. So I think we've got a job to do to get them closer.
Yeah, what we've seen work is where both approaches are in tandem with each other. It's not an either or. And on some of that kind of alternative engagement areas, we've got some really good examples of football teams being able to provide that engagement, because people, you're right, they don't want to go to the council or the job centre, but they'll go to the club. And so if we can get them in through these different, more accessible and trusted places and people, then it's how we put everything behind that once we've got them there. I'm conscious of time, so if I'll go to you, Kevin, and then Julia, but we need to think about wrapping up.
Yeah, I'll be really brief, but I'll touch on Julia surfaced something there. The key for the in our view here in Essex or South Essex is that in our hospital-based programs we work with this concept of preference. You know, health is shockingly bad. They'll say, oh, we've got 50 health and social care assistant. You know, how can you fill all those? Well, you know, that comes from the presumption that that individual wants to do personal care. It's not always the case. Actually, we're a really big employer with a vast range of jobs, from that job to call centres to nuclear pharmacies, all sorts of things there. So we're really lucky in that place. But I'm just going to raise a slight, I don't know whether this is a warning flag, but there's been a lot of conversation about the voluntary community sector in almost every forum meeting I attend. So I'm going to go back to my IPS, which is the underpinning model for Connect to Work. and the severe and enduring mental health experience as a voluntary community sector provider. And I think we need to really get underneath this business of trust, because sometimes that trust comes from a place where it's almost easier for the employment specialists who don't work for a public sector body saying, oh yeah, I'm surprised about that. Really? Your care coordinator suggested you do. It's that good cop, bad cop that can sometimes it works perfectly, but I think we just need to understand people use this trusted provide all of that. And what I don't want to do is in 5 years' time, look back at Connect to Work performance, Work Well performance, widening access performance, and find actually that we had something there that if we'd have looked closely at, we might have been able to mitigate and actually help to support that in the right way. So, sorry, I said I would go on not very long, but for the Essex is Working plan, you know, we've been trying to encourage people to think not about the voluntary community sector, but the wider workforce need in this space, because that's the critical bit. Thank you.
Julia. And
2 seconds. So Liz Trust asked me to do a pilot, goodness me, in a very short period, as you can imagine. We did this little pilot where we engaged with everybody in the community that people did not feel comfortable to come into a job centre. And it was the church, it was everybody. It has to be everybody. So I'm saying the same thing. There is a role to engage people through whatever it is, sport, music, church, rigid, whatever, then we can help and support. So that was very interesting. It was hugely successful, but it died, unfortunately, with Liz Truss.
Thank you. We need to draw to a close. I just want to leave people with some thoughts for next steps. This is our first Waves to Work session, and we want to come back in a few months and hear how people have progressed and moved on from where we are today, and to bring other of our CNN locations and partners into that. There's been some core themes today in terms of that smart use of resources, the tricks and challenges of employer engagement, getting better local integration, getting the pathways right, different age cohorts. And we've got a lot in the whole kind of Get Britain Working space. Growth of youth employment hubs. We've got the Widening Access Demonstrators Programme Phase 2 rolling out, Work Well rolling out nationally. We've got Connect to Work. What we really need to be able to do is evidence what this means for coastal areas and what are the different things that yourselves are having to do in order to overcome some of the challenges and barriers that we know are very prevalent in our coastal areas. So these are the things to think about. We want to keep engaged with you on this. We've been recording the session, taking notes. We will share that. We'll send that out. Some of you have already indicated you want to make connections with each other. Some great suggestions in the chat as well about additional things we can do from the CNN perspective in terms of sharing best practice examples. Yes, we have got some. We can be putting things like this together, and yourselves obviously contribute majorly to that process. So I hope the session's been useful for people who found it interesting. I certainly have, and thank you very much to all of our presenters, Mel, Hani, JP. Really, really interesting and valuable stuff. So thank you, everybody.